All right, it is 1 o'clock, so I think that we will go ahead and keep to our time, and other people will trickle in as we get started. So Angie, I'm just going to let you go ahead and kick things off.
All right, well, welcome everyone. I am really pleased with the folks that have joined us today. We are recording and we're going to distribute these afterwards. You are here because we're going to talk about how tribes can more easily access climate and health resilience data. So maybe you're here because you've already begun the work of trying to access all the data you might need for a vulnerability plan, an adaptation, vulnerability assessment or adaptation plan. We are in deep on that work. Shasta and I have been working on the Tribal Climate Health Project for a number of years. It's funded, federally funded, and we have gone really deep into trying to ease the burden off of tribes of doing a lot of the fact finding that's necessary to make meaningful, good decisions about what vulnerabilities to address so that you can put your time and money and effort into the most meaningful and effective places. So today it's all about where to access that data and hopefully how to save a little time and resources in the process. And so yes, Shasta is right. We would love it if you would introduce yourself. Give us your name, your organization, your location. This webinar is specifically for California tribes, but if you're from elsewhere, that's fine too. There's lots in here for folks outside of California. And if you want to tell us a little bit about your experience using climate or health data for adaptation or resilience planning, that would be great. You don't have to type a lot, but give us a sentence or two. You can say, I'm in a vulnerability assessment right now, or whatever it may be. So Shasta, do you want to introduce yourself here at the get-go?
Yeah, so hi everybody, and if you don't know me, you do now, and my name is Shasta Gaughan. I am the Environmental Director and the Tribal Historic Preservation Officer for the Pala Band of Mission Indians. We are on Payomkawachum territory, or Luiseno land, in what the colonizers call San Diego County in California. And our experience using climate and health data, there's a reason why we started the Tribal Climate Health Project, and it's because the experience before we started working on this has not been great. It's hard to get climate and health data for tribes because it tends to focus on broader boundaries, like at the county level or even up to the state level. So it's been a big interest of ours to be able to develop tools for people to get the data that they need that's more specific and tailored to their particular tribal communities. So like Angie said, please let us know, especially if you have a particular data source that you'd love to have access to, but that you've had trouble getting.
Right, and I'll introduce myself, Angie Hacker. I'm with Prosper Sustainably. We're a consulting firm, and we've been supporting the Pala Band of Mission Indians under Shasta for a number of years on a lot of projects, including my primary role as the lead consultant on the Tribal Climate Health Project. And so I'll be facilitating the majority of today. We also have with us Kelly Milligan from the California Tribal Epidemiology Center, who has been a partner with us on the project we're about to tell you about. And she's here to talk to you a little bit about how her organization is greatly helpful in helping you access some additional data that can support your climate change vulnerability assessment from a health perspective. So hi, Kelly, and we'll introduce you more a little bit later on in the program. So our purpose today for this webinar is to talk with tribal serving professionals and help you learn how to obtain and use meaningful tribal resilience data for future adaptation planning, implementation, and evaluation, and to help you inform decisions about climate and health resilience. Our agenda, we just finished our introductions. I'm going to go through a little overview of what the Pala Band has been up to. So they have, under the Tribal Climate Health Project umbrella, there is a whole data development effort. We call it our intertribal resilience data development effort. So I'm going to talk to you a little bit about that. Then Kelly is going to talk to us about how you can work with CTEC to request data. And then I'm going to walk you through a new protocol that we literally just finished developing, and I'll throw that in the chat too. There's a link to it, and that's going to be a protocol, basically a step-by-step guide to accessing data through the tool we're going to show you and through CTEC. All right. So thank you all. I can see folks introducing themselves. Please continue to do so. It's great to see you here. Okay, so like I said, the Palabanda Mission Indians has a tribal climate health project, which does a lot of things, including training and capacity building. But in the process of doing the curriculum and research to develop our trainings, which are national capacity building trainings, we really found out that there was more. It wasn't going to be possible to just hurl a bunch of information at people in the midst of a training and expect it to stick, expect it to be usable and manageable. There's over 30,000 potential data sets available that you could use to do your vulnerability assessments. So we were guiding folks on how to try to access that in the right ways, but what really made more sense was to start organizing that into a tool to make it easier so not everybody had to start from scratch, you know, ground level. They could at least have a better idea of where the information is, what kind of indicators to look for, how do you measure the severity and likelihood of the climate impacts coming your way so that you could better prepare for it. And so in that process, we decided, well, we developed this tool, we wanted to refine it, and we really got into the data development field. And so we had a BIA grant application through the Tribal Resilience Program for a project we call the Scalable San Diego Intertribal Resilience Data Development. Oh, project with a T, sorry. That project aimed to support tribes locally in San Diego and all across the country by doing development, analysis, and ongoing monitoring of epidemiological and other data sets for adaptation planning and resilience decision making. So what does all that mean? Epidemiology, by the way, is kind of a longer term for basically health-related data. And so we were looking specifically at health-related data, but other data as well. And we wanted to improve tribes' ability to gather all the facts that they need and all the information that they needed. And we wanted to look at the gaps. Where was the data missing and not accessible in the ways that it was useful? And then at the end of the day, we wanted all of this to increase the capacity of tribes to prepare for and address health and other impacts of extreme events and harmful environmental trends within their communities. So I just want to walk you a little bit through what we actually did. And this was over the course of the last couple of years. So we worked with 6 San Diego tribes. And so it was led by the Palabanda Mission Indians. We also were able to work with Rincon, San Pasqual, La Jolla, Jamul, and Campo. So those are all starred here on the map that you can see. And some of those folks are here with us today, so I would encourage them to chime in as they'd like to in terms of their experience in this project. But we basically got our partners together, which included those tribes, but also partner organizations that are experts in climate and health data. And what we wanted to do was first compile all the available tribal resilience data that we were already aware of because we'd been doing those years of work and looking at best practices and using this tool. And so we wanted to build upon that. And so we applied everything we knew through worksheets with these tribes to try to compile and analyze the data, provide it to them. And in doing so, looking out for where there were additional needs and gaps and talking with those 6 tribes about what their priorities were for data that was going to help improve their vulnerability assessment, improve their ability to really tailor custom adaptation strategies to the right threats or risks or hazards or concerns. And so that was some back and forth with the tribes that we were working with in a variety of the pandemic hit. So it was mainly online conversations, but also asking them to do some ranking exercises and things like that. Slightly painful, right? Because there's so much data that could potentially be used here, but they were patient with us and they provided us with some insights about what was useful, what was not. So we came out with a list, and I'll show you that a little bit later on. And the idea here was we were actually going to try to take some of what information we were receiving about gaps, data needs, and try to address some of them. We were going to try to fill some of these gaps by working with the partners that we had connections with that could actually provide additional data. So that was where the partnership with the California Tribal Epidemiology Center came in really handy in this project, because they have special authority and access to provide data, and they have it in a way that tribes are already find meaningful, and it's scrubbed and developed with the right parameters in mind. And so we were actually able to develop a brand new data set. And part of what we were wanting to do is then share this information out. So that's kind of what we're here to do today. This webinar is part of our grant scope to say, we developed some things that we think are useful to other tribes, and we would like to share that with you. And the goal of developing this data set with the California Tribal Epidemiology Center was that it was going to be mutually beneficial for both CTEC and the tribes in California if we could all sort of agree around a standard set of indicators and data that would be useful for tribes. That way, CTEC is prepared to provide data more readily, and the tribes don't have to sit around scratching their heads to figure out what kind of data CTEC has that they could access and could use that would be helpful for their climate change vulnerability assessment. So we sort of packaged this together in a way that's a protocol, and it's now far more easy for you to access some additional data that you may not have known you had access to before and might have taken a little extra work to get there. And so I want to kind of just put this in the context of why data is so important. And many of you already know, because you might be in the midst of doing your adaptation planning, but data is very important to the process of completing an adaptation plan or a resilience plan. Particularly, we've been focused on the vulnerability assessment side. So to prepare, basically the first thing you do when you do an adaptation plan is prepare a vulnerability assessment, and that is to attempt to identify the impacts of climate change on your tribe. And so to do that, it's really critical to first understand the unique and significant vulnerabilities. And so for us, when we think about vulnerabilities, we have a whole training on this, but in short, you're looking at what is the exposure risk, exposure meaning what is your community going, what changing climate conditions is your community going to come into contact with that it doesn't necessarily control. Things like wildfire, drought, temperature extremes, melting ice and sea level rise, storms and flooding. Those are all what we consider sort of direct exposures. And how do those cascade down to effects on your community, which might include health and social impacts, natural environment impacts, and built environment impacts. And then how do those things actually affect the things you care about, which we call valued community assets. And on top of that, your risk, the vulnerability level is really moderated by community characteristics like, is your community extra sensitive to these climate exposures for any reason? For example, do you have a large population of elders and elders happen to be less able to properly regulate their bodies to temperature extremes? And so perhaps you are particularly sensitive as a community because you have some characteristics that make you that way. And adaptive, or you may have, you may lower your risk because you've already done some things that give you extra adaptive capacity. Things like if you have extreme heat coming at you, and we all do here in California, maybe you've already done some things to prepare for that, like developed a cooling center or increase the housing habitability in your tribe, including more air conditioning, things like that. All those things come together in developing a ranking of vulnerabilities so that you can try to figure out what vulnerabilities, what impacts are the most concerning, most severe, most likely, so that you can focus your attention, resources, and time there in your adaptation strategies. And so I'm talking about all of this because data factors into each part of that equation. You won't know about your changing climate conditions unless you go and look at the data. And you won't know what data to look for unless you understand what indicators might look like. And so I'm going to share with you how we've done some of that. You also may not, you can look at impacts. You can see, for example, if temperature extremes is an exposure that you think is going to be severe and likely for your community, a potential impact, of course, would be a heat-related illness. That's an impact that you can actually go and look at data for. For example, places like CDC and others have access to heat-related illness data. And then you can also look at data for population sensitivity and adaptive capacity. For example, we can, you can find out what your population is, the age of your population. You can find out how many people do have air conditioning, whether or not what's your urban heat island index? There's all sorts of pieces of data, and it's a lot to consider. So factoring all this information in maybe is another training, but today we're going to talk about how you actually find all of these facts. So I want to talk to you a little bit about the tool that we built. We started building it as we were developing the trainings, and now we're building onto it and onto it. It's called the Exposures, Impacts, and Strategies Inventory. We call it the EASY tool. And it really needs to have an R at the end somehow, because it's easier. It's not totally easy. It's easier than if you were left all by yourself. And so what it tries to do, it's a companion to the Tribal Climate Health Project's training. The point is to try to ease the fact-finding burden on communities and free you all up to do the work, like making meaningful decisions, getting your community involved, and engaged in making these decisions, and ideally moving past all of this into the process of actually taking action and implementing your adaptation strategies. So this tool, which I'm going to show you just little pieces of it, is filterable and customizable. It's in the form of Excel, which not everybody loves. And in fact, Shasta and I would love it to be something better, but that's what we have today. And it's kind of an organized menu of a lot of things, including and the point of it is to track vulnerabilities and adaptation strategies. So to evaluate and track vulnerabilities and adaptation strategies. So I'm going to walk you through a few different tabs, and those tabs include menus. So we have vulnerability indicators and accessible data sources for exposures, secondary exposures. Secondary exposures we basically define as exposures that might be triggered by one of those primary exposures. So for example, we know that temperature extremes are a primary exposure. Probably all tribes in California are thinking about it. That will trigger worsened air quality, because we know there's a relationship between high heat and increased levels of ground level ozone. And so there's a host of other secondary impacts. Those impacts have those exposures have impacts on the natural environment, built environment, health and social environment. And so we have these long menus of all the ways that these exposures could possibly impact your community in those different ways. And alongside that, we have the indicator. So basically, if you're asking yourself, well, how do I know? How do I know that heat-related illness is going to be really a problem for us? Well, we can go look. We'll show you the ways to measure it through indicators and the places to go for data. And we also have a whole list of population sensitivity and adaptive capacity indicators and data sources for you. And then on top of that, we're not going to spend a lot of time on it, but we also have a whole tab devoted to adaptation strategies, so that the whole point is you don't have to go do all this years of research to figure out what the best sources of information are, best practices and examples. We've at least taken that off your shoulders. Okay, so actually what I want to do here for just a moment, and feel free, anybody can stop me and chime in if there's questions as I'm rolling along here before the next step, which is where I'm going to hand it off to Kelly to tell you a little bit about what they do. So Shasta, if you see anything coming through here that folks need help with, let's just go ahead and chime in.
Yeah, and feel free to raise your hand. You should have that option, and I will unmute you, or you can just put your question in the chat.
And actually, while I pull up the EASY tool, if anybody does want to share, if this is resonating with you and you say, yeah, I've tried to do this by myself. And if you want to talk to us a little bit about your experience trying to identify all of this information on your own, that would be super helpful. We'd love to hear it.
And we do have a comment here from one of our attendees, and I apologize if I pronounce your name incorrectly, but it looks like I Samai, who is on Rameto Shaloni land and a member of the Urban Permaculture Institute, and says that they're looking for two pieces of data: a searchable database of who has recently composed a data story in my geography or demography. And so by data story, I'm thinking like the story maps that you can do through Esri. And then also a filter that shows data collection processes like participatory action research or other forms of data collected by community-based or centered researchers. And by that, I'm thinking you want to know what other data has been collected already by other community researchers, which would be great to be able to see what other people have already done. And the response is yes and yes. So good, I got that right.
Well, I would be very happy if we have lots and lots of data enthusiasts on the line here. This is a big topic. And in fact, I'll just chime in here to say the federal government is looking at this. So this is the right time. Federal government, and I even see some folks from the state here have joined us. A lot of folks are trying to figure out how to get communities moving along a little faster, a little easier on this front. So we're sort of compiling good ideas, so feel free to share them with us. Okay, so I want to show you where to find the easy tools. So if you've ever been to our website, you can go to tribalclimatehealth.org and go to the Learn tab and go to Training Materials. And I just actually threw the link in the chat box too, so you can get right to this page. This isn't the prettiest web page in the world, but it provides you with all of our past trainings. But what I want to do is point you down to this section, which is our adaptation planning tool. And you can actually download the easy tool right here. It's a link, it's an Excel tool, it'll download to your computer. So all you have to do is click on that and you should be able to download it and it will pop up like this. So this is just the intro page, which used to host instructions, but since we just developed a protocol, all it does now is points you over to a protocol, which we're going to talk about a little bit later. And I just want to introduce you to sort of the main features of this tool. Because if you're in the midst of doing this work right now, it could actually be useful to you today. So the first thing that we often suggest to tribes to do is to look to evaluate their climate change exposures. And that looks like looking at those 5 main primary exposures that we talked about. So drought, temperature extremes, wildfire, storms and flooding, and melting ice and sea level rise. And so one of the first things that you can do in this tool is to just filter by your region. And so everybody here today would be in the either southeast or west or northwest, and you can filter by that here, by this region. At the very least, that would actually tell you all the potential exposures that the research says your area would be at greatest risk for. And it will give you an entire list or inventory of exposure indicators, which are basically us mining from all the best practices, state, federal reports, other tribal vulnerability assessments. How would you measure? So for example, if we're on drought, how do you measure drought? How do I know how severe and likely that is to come to my community? Well, you can look at mean daily precipitation. You could look at days of no precipitation or dry days. You could look at days of precipitation above 1 inch. So there's a lot of options, more options here than you would even have time to take, but basically you take from this what you feel is most relevant for you. And on top of having these sort of Western science indicators, we also have included in here places for local observation, traditional knowledges, so that folks from your community can actually apply what they know. So if you're working with your community or if you have records in-house, traditional knowledges or internal reports, we have some places for you to include observed precipitation changes or snow melt or observed changes in water supply. The way this is constructed is that basically it provides indicators, and then for each indicator where we have a known data source, we placed it in these columns. We have national data sources, which means any tribe across the country would be able to access them for their particular area, downscaled as much as we could find it. And if there is something that we have found, there's a link that takes you directly to where to find the data for that indicator. And for California, because there's so much great data here in the state, we've linked directly to California data sources. So typically these are online platforms. They oftentimes have not just tables of data, but things that are more visualized, charts and maps and things. And so we look at historical, baseline, and projected information if we can find it. And if we have it, we point you to it. And this is just built like a worksheet, so you can actually drop in your findings into these cells as a way to keep track of what you're finding out, because eventually you'll end up putting it into some sort of a report and assessing the trends that you're seeing and writing it out in a narrative way, because you're going to make sense of all of this and have to communicate it up to some decision makers, probably your tribal council. And at the end here is an exposure risk level. So you would kind of look across, if you're looking at drought, if drought's of a concern, and you look across all the data that you could find in your data findings, looking at trends, you could give a ranking, high, medium, or low, in terms of whether or not you think that this exposure is considered severe and likely to come to you. So that's basically the way exposures works. And the impacts tab goes further, but kind of works the same way. So not only do we know that heat, temperature extreme, wildfire and storms and flooding may be coming to you, but we want to know, why does it matter? This ties all of those exposures to possible impacts. And so this column here has many, many, many possible impacts tied to each particular exposure. So like I said before, temperature extreme, heat-related illness would be a possible impact. We've categorized each of those impacts by type. So we have human health, cultural and spiritual health, socioeconomic health, we have natural environment and built environment. And so for each of those, same kind of thing. We say, how do you measure it? Well, here's a variety of impact indicators. So heat-related illness could be measured in a lot of ways, like heat stress emergency response. Emergency department visits. Heat-related mortality, premature deaths due to heat. So there's a lot of different ways to look at it, and the data comes from a variety of places. Like I said before, the CDC, National Environmental Public Health Tracking Network, is a really good one. So we point to that quite often if it's health related, but this isn't just health related information. And so same thing here, you can drop data findings for historical, baseline, and projected information. And then there's other stuff hidden in here that we don't have time to really go over, but it would help you tie together the moderating factors of population sensitivity and adaptive capacity alongside what your community tells you that it really cares about. So those community assets that could potentially be threatened by climate change, like the physical wellness of your community, the educational opportunities of your community, your water supply, your tribal sovereignty. All those are things we consider assets, and we actually go out, and when I do an adaptation plan, I go out and survey the community or talk to them and find out which of those are really the highest priority that they want to protect from the impacts of climate change. Because across all of this information, at the end of the day, what we're looking to do is to develop a vulnerability impact level, meaning for heat-related illness, or all of the ones that we have listed here, which really do range pretty broadly because climate change affects a lot of the things we care about. What are we going to say about this impact? Well, the data looks like we're not experiencing a lot of heat-related illness yet, but projections for heat changes might change the projections for heat-related illness. So maybe it's a little higher, but our community has a low urban heat island effect, so maybe that helps, or maybe we have a large tree canopy. And at the end of the day, our tribe completely agrees across the board that physical health is a really high priority. So maybe this is a high impact level or a high vulnerability level. So you go through and rank all of this. So this is the quick and dirty demo of a tool that obviously has a lot going on in it. And I'd be happy to share more information with anybody about what else is here. And what we don't have time for really today is to talk about strategies. These are the adaptation strategies that you could use and pick and choose from and help and do some initial evaluation and planning on when you get to the point of doing an adaptation plan, but that comes after identifying your vulnerabilities. Okay, so that was a somewhat manic demo, and I'm sorry to chuck a bunch of information. I mainly wanted to tease that out so that I would encourage you to go to the link and download and tinker with it yourself, and then contact us if you would like more information about how to use it. And I'm going to point you to the protocol that we just wrote, the step-by-step guide, so you can also use that. Okay, so so we use that tool with those 6 tribes in San Diego, And we did identify some gaps, and there's some real general gaps in climate information in general, including sometimes data is missing completely or only available in these scholarly articles, which nobody has time to go mining for and doing the evaluation and analysis themselves. And so things like, we had a hard time, we ended up finding it, but things like allergens and allergy rates, that was hard to find at first. It might have been in, yeah, like I said, academic articles, but not made very, what I call community ready or very accessible to you. So you could be like, oh, here's a website, here's my parameters, pop it out in a nice table, pre-calculated. Hopefully there's a map or a chart. We often found that data is not location specific enough. So Shasta kind of touched on that, like things like groundwater and stream flow levels. I hear that there's actually a state of California effort on this front right now to do a better job compiling and aggregating water data. That probably sounds controversial or potentially scary to some tribes, but those are the types of information that we have a really hard time accessing, at least at a scale that's meaningful enough for tribes. And even things like asthma rates, which there is a definite relationship between climate change and potential for increase in asthma incidence. That oftentimes you can only get down to, say, like a county level. It's really, really hard when we're talking about tribes to expect to get anything at the perfect boundary of a tribal reservation, or for tribes that have lots, like say a high population of off-reservation tribal members. How do you even cut the boundary that way? So, but getting downscaled enough is a real challenge. Sometimes data is missing timetables or timescales and projections. So oftentimes maybe you can get like some data from 2005, but nothing super recent and nothing that projects into the future. Or, you know, that's just an example. You're just missing timescales. For health data, it's very rare to get anything forward-looking, meaning like modeled out and projected information about or where we see health impacts occurring. So we keep talking about heat-related illness, or maybe we're talking about West Nile virus incidents, or maybe we're talking about storm and flood-related injuries. It's very rare to see those modeled out into the future, so you can make some good decisions about it. So there's assumptions that are made. And then often data is not episodic, which basically means, say a wildfire comes along, I can tell you on an annual basis what your PM 2.5 air quality looks like, but I'm not able to easily access information that says, when a wildfire comes through, your particulate matter is off the charts, and here's how severe and likely that is to happen to you. Episodic means climate change can be, the impact we're looking at can be easily attributable to climate change. So we have a long list of outstanding data needs. Fortunately, though, we were able to address some of these needs through working with the California Tribal Epidemiology Center. So I want to tell you about what we were able to access to help start to fill some holes. And this effort feels like it could be endless in terms of the kinds of information we could continue to collect, but I think we got some good stuff. And what was very great was to have worked with tribes in San Diego to tell us whether or not this was useful information, and to help really narrow down what indicators and data to look for. So this is the kind of information we got from CTEC. So it's great because CTEC understands tribes, and they actually categorize things in sort of a beautiful way. And so there's data that falls under a healthy mind, and then there's data that falls under a healthy body, and data that falls under a healthy community. And so all of these that you see here are what we would consider like an indicator. The indicator would mean, it does this, would the trends on this data indicate a concern? Should you be looking at this? So things like depression diagnosis, physical activity, social cohesion, really interesting stuff. And what we have done is taken this information, plugged it back into that easy tool under the right, where it would apply to the right exposures and impacts, so that you can use this data to measure out, at the end of the day, try to get down to understanding your biggest vulnerabilities. So this information helps you narrow down and understand your biggest vulnerabilities. And feel free to chime in, anybody. I think Shasta, can you be monitoring chat? See if there's anything that I should be stopping for.
Yep, you're good for now.
Okay. All right, so I do see, let's see. Lori has asked how data should be looked at. Oh, this isn't a question. Another aspect that can make data difficult. Trends that are counted in 30-year chunks while others can be analyzed annually or by decade. Yes. Yeah, the EASY tool does not get so prescriptive about what timescales to use because the data is coming from all sources and there was really no way to standardize it to that level. Although I think in the industry, folks like to see trends and annualized data, looking at maybe average annualized data over like 30-year periods and things like that. So did they survey to get stats on social cohesion? Oh, that sounds like a question for CTech. So let me go ahead and pass it over to Kelly. So thank you, Kelly, for your collaboration on this project and for being with us today. I'm going to leave it up to you to walk folks through your slides.
Great. Thank you so much, Angie. And thank you, Shasta, for inviting us here today. Angie, do you want to go through the slides or would it be best if I just shared my screen and went through them?
I've got it right here. You can just tell me when to advance. That's
okay.
Easy. Okay.
Perfect. Yeah. So my name is Kelly Milligan. Just a little bit about me. I work at the California Tribal Epidemiology Center. I'll refer to it as CTech for the remainder of the presentation. But I have been working there for several years. So environmental health data is my background. So I'm really excited to be doing this work with Paula and with Prosperous Sustainability. So one thing that we did in this work, well, I should say, first and foremost, I'm joining you today from Miwok territory up here in Northern California, very hot Sacramento. So I'm really excited to be here. Go ahead and advance to the next slide, please, Angie. A couple things that we'll talk about today, as Angie prefaced, so I won't spend too much time on this, is our environmental health data tool that we provided. I'll discuss a little bit of CTech services that are available for California tribal communities and identify some of the data sources that CTech has access to for California at the tribal level or for our tribal communities. If you want to go ahead and advance to the next slide. Perfect. And you know what? Actually, this is a link. So Angie, if I could share my screen,
oh, sure.
I'm going to link into our data tool. So this gives us a breakdown. Let's see. Thank you so much. I'm going to jump into the climate health tool, and then I'll jump into what CTech does and a little bit about us. So perfect. That should be sharing our tool. So we worked with Angie and Shasta and the tribes in the San Diego area to identify what the indicators were that were of interest specific to environmental vulnerabilities. So we at CTech work exclusively with health data, health information. We work with data that is collected through primary means by us or by our tribes. And we work with data that is secondary. So it comes from the state, from the county, as well as from the federal level. So we have access to a range of different data sources, which is great. So in this request, we worked to identify the different indicators of interest. So this kind of on this first page, when requesting data from CTech, this is how we tend to present it. We'll identify what the request was, the description of what we were able to provide, the date in which we were able to provide it. This is an example of some of our data sources, which I will go through in a little more detail in a few minutes. And then some of the limitations of the data, of course, because we all know that in working with data, there are always limitations to the data. So jumping into the requested indicators. So this is, let me see if I can zoom out a little bit more. Very similar, we have an Excel tool. I love Excel. So I'm really excited to present the data in it. So what we did is working with Paula, we identified the indicators. So we said social cohesion was of interest, unemployment rate, days of physical health. And these Angie just went over, so I won't spend too much time on them. But within this indicator, we identified what the data was that we had. So we, using different data sources, were able to identify 3 different survey questions that we had across the state to give us data on social cohesion, to give us more information on it. So we looked at, for example, in this instance, people in the neighborhood that are willing to help, people in the neighborhood who do not get along, and people in the neighborhood that can be trusted. And those were aligned with identifying our social cohesion. And we used this data source. So CHIS is referencing the Community Health Interview Survey that is done by UCLA. And we looked back longitudinally because we know that in environmental health data, it's really important if we can look back over time. Our preference, of course, would be as far back as possible. But that is one of the limitations of some of the data that we work with, is we might not have different measures over long periods of time. So in this specific social cohesion and the Community Health Interview Survey, we were able to go back to 2013 with pretty consistent metrics since. They did capture this information back in 2003, but we do have about a 10-year gap, so that makes it challenging. But with this, we were able to provide American Indian Alaska Native data and compare it to our non-Hispanic white population here in California. One thing that we do is we work with all of our data sets to identify the smallest level in which we can kind of drill down. Can we provide data at a tribal level? Can we provide it at a county or a zip code level? And every data source that we work with is very different. So for the purposes of some of these, for example, the CHIS data, we were able to access at a San Diego County level. So we put a little bit of information in the data notes. So this is just an example of how we can obtain some of this health-related indicators. And some of the sources, so we look at the population sensitivity, adaptive capacities, as well as the impacts. And these were the ones that were identified as important to the San Diego tribes. Now we also can, if there are additional metrics that are of interest, I know I was on a call the other day and we were talking about pregnancy, loss, and heat-related index. And so those might be data that we can access from our different sources, whether at the state level, federal level, or county levels. So that's an example. So I will not spend too much time on this in the interest of time, but I will we did break it down to provide some data visualization for examples of our indicators that we provided. So this goes into a little bit more detail of the data source, the range in which we were able to provide the data, some of the limitations that come with the data sources that we access and work with, and any additional limitations, such as, and you can see it in an asterisk here, and it indicates the years of low sample sizes among American Indian Alaska Natives in the data. So oftentimes there are, with a lot of our large scale interview surveys, health surveys, we cannot get tribal level data just because we don't have enough responses from at the tribal level. So we want to be really careful and interpret with caution to make sure that we are ensuring that the data is as representative of the population that we are discussing as we can. So I will stop sharing this and we'll go back into some of the data that we have. Angie, if you want to reshare that screen.
Oh, sure.
Thank you so much.
Is that the right slide, or do you want to go to the next?
It's showing the website, your California Tribal Gap Analysis.
That's the wrong screen. Hang on. Aha.
Perfect. Thank you so much. So this is some of the data that we just provided in that tool. Angie, if you want to move to the next slide. We can go ahead and skip that one too. That was just in case we couldn't access. A little background on CTEC. For those of you who are not familiar with us and the services that we provide to our tribes, tribal health, and urban Indian health programs, we are one of 12 Indian Health Service Division techs across the country. We were established back in 2005, and our main goal is to assist in collecting and interpreting health information for American and Alaska Natives here in California. So we do serve all 109 federally recognized tribes. That's our mission statement. I won't spend too much time on it. You're welcome to go to our website to find out a little bit more about the work that we do, but we can go to the next slide and I can provide a breakdown of some of our services. Some of the things that we do in addition to accessing data, like we did in this instance, we can collect data at the tribal level. I think that is arguably the best quality data that we will ever get, is data that is collected by the tribe for the tribe. And I know that that's very difficult to access and obtain at times. So we will work with tribes to collect data. We can help evaluate data and programs at the tribal level. identify health priorities with tribes. So we do this through vulnerability assessments. We also do it through community health and needs assessments. We can make recommendations for health service needs based on assessments that we work with tribes on. And then in this instance, we provided epidemiological technical assistance for the tribes and tribal organizations. And we also do work with disease surveillance. That's currently we've been doing a lot, of course, around COVID, but we do a bit around in the environmental health sector specific to vector-borne or zoonotic diseases. Next slide, please. So as far as data sources, if you are looking to obtain data from CTEC, we do have quite a bit. This is not an exhaustive list. You know what, the screen just went away, Angie, I'm sorry. Thank you so much. Yep. This is just a few of the data sources that we access regularly. We do have California Department of Public Health data for a number of indicators. We have Indian Health Service EpiDataMart. We have the California Behavioral Risk Factor Surveillance Survey that some of the indicators that we worked with Paula on are provided from. So we do have that data set that we can analyze and provide at the lowest level possible. And we can work with you to identify what that lowest level is. We have the California Tribal Behavioral Risk Factor Survey. The challenge in that with environmental health data is we have not tracked it longitudinally over time, but it is a great survey, a great tool that does address a lot of those environmental vulnerabilities that Angie discussed earlier. We also have that specific to Tribal Youth Risk Factor Survey. So we do have some tribal level data just for our American Indian Alaska Native population here in California. The UCLA California Health Interview Survey is another great resource that we have. We worked with UCLA and over the last several years to do an oversample of American Indian Alaska Natives to get better data, more representative and at a more drilled down level. We also have CDC Wonder, which is mortality data. We work with Whiskers, so injury data, and the American Community Health Survey. So a lot of different data sources that we can access. And again, this isn't exhaustive. This is just an example of some of the data that we can access. There are limitations in the data, and I will kind of just share on that for just a moment. Oftentimes, as I said, if the sample size for some of the data that we are accessing is too small, we want to be very careful and interpret it with caution, because we always go into this making sure our data is as representative of the population that we are describing as possible. But we're really happy to work with everyone and anyone on any data they might have or want analyzed, as well as accessing data. So we're really excited to be partnering with Angie and Shasta on this to access data to support your vulnerability assessments. And with that, I think I'm going to turn it back over to Angie so she can go over next part, but this is just a way, she'll go over the protocol of how you can request this information from us.
Thank you so much, Kelly. That was great. And folks with questions for Kelly can raise their hand, throw something in the question box or the chat box. And Shasta, would you mind monitoring for that?
I am monitoring, and I also just shared the slides as a PDF into the chat. So if folks want to download that. We had Lisa asking if she could get, Kelly, your Excel workbook, so what you were showing on your website.
Absolutely. Yeah, I can. My email is right up there on the screen right now, and I'll enter it into the chat. You can feel free to email me and I can get that to you.
Great. And then there was also a question about how the data is collected and packaged for unrecognized tribes.
That's a great question, and it will depend on the data source that we are working with. So we do absolutely work with state recognized or unrecognized tribes in California as well. It really will depend on the data source. So I'm going to leave it at that, and I'm happy to discuss that a little bit further, specific to our tribal data collection methods a little bit one-on-one. So you feel free to email me.
So like Kelly said, we've gotten some really good pieces of data from CTEC. There's probably more we could grab, but we are continuing this effort, and I'll tell you a little bit about some of our next steps. But I really just want to emphasize that at the Tribal Climate Health Project, we really feel like health is an element of vulnerability assessments that has not in the past received enough attention. And it's where we focus a lot of our attention, because we know that's where the suffering occurs, is the effects to human health, including mental health and well-being. And so I came across a recent article that said a stable climate is the most fundamental determinant of human health. And I thought, wow, because a lot of us are talking about, you know, determinants of health. And yeah, without a stable climate, all other, you know, efforts to improve human health globally are going to struggle a little bit. So we just wanted to emphasize that this health data can really take your vulnerability assessment to the next level, and CTEC is truly a unsung hero, and probably just like an unlikely, maybe you haven't thought about working with CTEC as you do your climate change vulnerability assessment, but man, they can really support you in a lot of ways. So I want to talk to you a little bit more about the protocol for how to go about accessing their data. And so we just hot off the press is this our new tool, or our new guide. This is the Accessing Tribal Climate and Health Resilience Data, a step-by-step guide, and you can download that at our website. And I'm actually just going to pop this up again so you can see exactly where it is. So again, tribalclimatehealthproject.org. You can go over to learn, down to training materials. It'll pop up this long page. And so if you go to the adaptation planning tool, here is a link, and this, maybe I need to put it somewhere more visible, but if you click here, this is where we have the step-by-step guide for using this tool and requesting CTEC data. So you can access this PDF right now if you're online. And so this tool actually is broken down by two main sections. So one is a step-by-step guide for using the easy tool, and the other is a step-by-step guide to using doing a CTEC data request specific for the data set that we were able to design together that Kelly showed us. And so let me actually I'm going to pull up the guide itself. And so it's not the longest guide in the world. I just want to go down to the CTEC section, which starts on page 8. It just talks a little bit about the data that's available, but for your first step is to just submit a data request for technical assistance through the technical assistance request form. And so the link is here. Kelly shared the link as well. Kelly, if you are able, can you drop that link right into the chat box as well? It's not a very long form. All you would do is fill it out. This is showing you a part of the form, not the whole thing, but I filled out this part because I think this would be a guide to how you might fill out your own. And so you would click data, your type of assistance required, topic of assistance requested. And then here is a suggestion for how you would access this particular data set. So we are requesting the Tribal Climate Health Project CTEC climate and health data set to help support climate change adaptation planning. I think that would be enough, right, Kelly, to flag Kelly and the other folks at CTEC to say they want this data set. We tinkered around with whether or not we were going to have you all manage the more complicated template to do the data request, but instead, if you just say this, Kelly and her team will know to use that data set and fill in for your community as location specific as they can with the barriers that they have, including things like confidentiality. The second step would just be to give it about 2 to 4 weeks to receive the requested data from CTEC. So they'll provide that to you in the template that was shared, which is an Excel document, offering you at least 5 years of annualized data for the parameters, for like the standardized parameters that are already plugged into the template. But it doesn't mean that you have to end there. So for example, once you receive it and you review it, here it is again, looks like this. At least this looks like a portion of it. You'll also receive charts and things. If you want additional help, you can get it. So that's the third step, get more help. If you have questions, need more clarification or technical assistance, or have data needs, such as different indicators, timescales, location, populations, please reply directly to CTEC, and here's the contact information. And here's Kelly right here. So she's she's a gem. She actually is totally willing to have people contact her directly. So, and the rest of this protocol, I'll let you kind of peruse on your own if you want. So if you are interested in the easy tool, this can walk you through how to use that as well. Sort of step-by-step guide with screenshots and marrows and things like that. I want to make it clear though that two things. The easy tool is totally customizable. It's not very locked up, meaning like you can change how everything's worded, you can add to it and delete. And you can always contact us for support. And to get the CTEC data, you don't have to use the easy tool. You can just use it. You can just go right to CTEC and get that those data sets directly. These are all voluntary. These are just for you to use if you'd like to, all in an effort to try to make this process slightly easier than it is, or hopefully a lot easier. So I think I don't need to go necessarily through, instead of telling you everything we've learned in life, which we've sort of already done, I just want to tell you what some of our next steps are, and then I want to open up for a question or two. We are continuing to improve our tools. We were super fortunate to receive a second round of BIA funding for this project. So rather than just stay in San Diego, now we are scaling up to Southern California. So we'll be working with 5 tribes, little north of San Diego in Southern California. And we're going to do the same process, going through the compiling all the information in the easy tool for those tribes to support their vulnerability assessments. And then again, sort of truth testing or ground truthing whether or not this is the right data, what other needs and gaps are there, and then going out to some additional agencies to see if we can address more gaps, compiling it again, updating our protocol, and updating you on how it's going and what else we have available to you. And I'm really excited too, because we are just about to launch a national tribal resilience data work group with all the experts we know around the country who are also focused on this. So some of them are on the phone, and we're just really super happy and excited to come up with more solutions with you. I want to take a breath here and ask if there's questions or anybody who was part of this project that wants to chime in and tell us a little bit about your experience.
And while you're thinking of your questions, since Angie just mentioned the ongoing project, we are looking for tribes to volunteer to work with us. So if you are interested, if you're in Southern California and you want to be part of round 2 of our data development project, please do send me an email, and I will put my email into the chat, although people already know how to get in touch with me, but just in case, I will go ahead and put that in there. And we would love to have some of our tribal colleagues contact us and be a part of our next round. And at the moment, I am not seeing other questions. There's some back and forth here about how people couldn't see the file that I had dropped into the chat. Some people could, some people couldn't. So I don't know what the deal is there, but we will email it out. And also this webinar is being recorded, and we will be making it available through our website over the next couple of days.
Well, I'll just finish with some thank yous then. Thanks to the BIA for funding this work. Thanks to the other 5 tribes that participated as guinea pigs with this. And hopefully we're benefited from some totally free, pretty hardcore consulting support. And thanks to Shasta and Paula for continuing to be awesome national leaders on all of this. Thanks to CTEC for being a partner. And thanks to all of you for participating and attending today. We'd love to hear from you some more, so stay in touch.
Thank you, everyone.